cancer, laryngeal cancer, pharyngeal cancer, anal cancer, penile cancer in men, and cervical, vaginal, and vulvar cancer in case of women. So this is the structure of the DNA. It is actually non-enveloped and contain a double-stranded DNA genome, and over 200 different types of human papilloma virus have been identified and characterized till date. So out of that, we have categorized the HPV into two categories. Number one is the high risk and low risk. Now, high risk, there are 12 HPV types which are high risk. That is, they can cause cancer. That means oncogenic, and they can cause cancer in humans. That is type 16, 18, 31, 33, 35, 39, 45, 51, 52, 56, 58, and 59. And out of these, 16 and 18 are the most dangerous. And type HPV 16 is the most oncogenic. The global HPV prevalence is estimated to be 12%, and it is most commonly seen in case of young age groups in the individuals, less than 25 years. Women infected with one HPV type may be reinfected with the other types of HPV as well. And women living with HIV virus, they have an higher tendency and prevalence of developing HPV infection. Globally, cancer cervix was the fourth leading cause of cancer and cancer deaths in women in 2020, 8% of all the female cancer deaths. HPV 16 and 18 together responsible for 71% of the CA cervix. So HPV vaccination is very, very important in today's world. Type 16, 18 and other high-risk types, these 7 types, they contribute about 90% of the squamous cell carcinomas that are positive for HPV DNA. Now, how does this disease spread in general? So there may be two types of spread. Number one is the direct contact that may be due to infected genital skin, bodily fluids, and mucous membranes as well, and due to sexual intercourse, which includes oral sex as well. And most of the HPV infections, 70 to 80%, as I said, is asymptomatic, and they resolve spontaneously within 1 to 2 years. But the problem arises when it persists for a long period of time. The interval between the accusation of HPV infection and progression to invasive carcinoma is usually 15 to 20 years or longer. Now, what are the predisposing factors and risk factors for HPV infection? Number one is the high risk type. As I said, there are 9 to 12 types of high risk HPV viruses which can cause cancer, and immunocompromised individuals such as HIV and other autoimmune diseases, co-infection with other sexually transmitted diseases, multiparity, young age at first pregnancy, recurrent use of hormonal contraceptives, that OCPs that we take, the 21 days pills, tobacco smoking, and also sexual exposure.
Ma'am, what is the young age over here? I mean, the definition of young age? Below 18
Actually,
or something
young
like
age
that?
is less than 18 years. Teenage pregnancy, I mean, teenage pregnancy. And also, if the sexual exposure is at a very young age, then also it can contribute to HPV infections.
Okay.
Tobacco smoking, and also tobacco smoking. Now, how can we, WHO, World Health Organization, Global Strategy to Eliminate Cervical Cancer 2020, there are 3 different levels of prevention. Number one is the primary, secondary, and tertiary prevention. Primary prevention, 90% of the girls aged 9 to 14 years should be vaccinated with the HPV vaccine. This is the primary prevention. Now, secondary prevention, 70% of the women screened using a screening test twice in their lifetime by ages of 35 years and 45 years, and 90% of the women with pre-cancer treated. That means who are already positive for HPV vaccine, the secondary prevention is for them. And tertiary prevention, 90% of women with invasive cancer should be managed either by hysterectomy or radical hysterectomy. Now, screening of cervical cancer. How can we screen for cervical cancer? So there are two kind of tests. One is the Pap smear that you might have heard of, and Pap smear or liquid-based cytology, which is LBC, and HPV DNA test. Then WHO recommends HPV DNA test for screening starting at the age of 30 years and repeated at 5 to 10 year intervals. Now, what is HPV vaccine? The first vaccine, which was licensed in 2006, administration if possible before the onset of the sexual activity, that is before exposure to HPV. That's why we have started young girls of 9 years till 16 years is the first group that should be vaccinated with HPV vaccine. Vaccine is prepared using recombinant DNA and cell culture technology and do not contain live biological products or viral DNA, and therefore it is completely non-infectious. All HPV vaccines
Ma'am,
are
what is the
indicated.
meaning of non-infectious over here? The
Non,
vaccine is infectious
these
means?
are there are two kinds of vaccine. One is live attenuated vaccine, and other one is not live attenuated. So this is here, it does not contain any kind of live viral DNA. So it is not infectious. There are some vaccines, people say that if you vaccinate the patient with live attenuated vaccines, they get fever or they can be infected as well. But this vaccine does not contain any live biological products. So this is non-infectious.
So you mean there is no side effect to the after this vaccination?
No, there are no side effects after this.
Okay.
All HPV vaccines are indicated for the prevention of cervical pre-malignant lesions and cancers and anogenital warts as well. The vaccine should be administered intramuscularly. You can take it right on the upper arm, and also you can take it in the buttocks or thighs. In the deltoid, but specifically, it should be given in the deltoid region, that is the upper arm. The standard dose is 0.5 ml. All HPV vaccines should be maintained at 2 to 8 degrees Celsius, not frozen, and it should be always protected from light. Bivalent, now what is bivalent vaccine? Cervarix, it is not available nowadays, but but initially in 2006 it was available, and it contains VLPs against high risk HPV types only 16 and 18. That means it covers only 16 and 18, and it is effective only against the type 16 and 18. Licensed for girls and boys as well, aged 9 to 14 years, and a two-dose schedule was used 5 to 13 months apart. If age is more than or equal to 15 years, then 3 doses should be given at 0, 1 to 2.5 months and 5 to 12 months. But this vaccine is usually not in use in today's world. Quadrivalent HPV vaccine
If
contain.
this vaccine is not useful in today's time, then which vaccine is useful and that to be given?
Today we use Gardasil 4 and 9.
Okay.
Gardasil 4 and 9. I'm going to talk about that only now. Uh,
Okay.
Quadrivalent HPV vaccine, that is Gardasil 9. It is licensed for girls and boys aged 9 to 13 years as a two-dose schedule, 6 months apart, and from age 14, a three-dose schedule should be given at 0, 1, and 6 months usually. So we start the vaccine from 9 years of age. If the girl is less than 15 years, we give two doses, 6 months apart. And if she is more than 15 years of age, then a three-dose schedule should be given at 0 day, 1 to 2 months, and 4 to 6 months.
So this is a this is a lifetime once vaccine?
Yes, yes. You have to take 3 doses.
Maximum 3 doses, otherwise
Yes,
two
the maximum
doses.
is 3 doses today, after 1 month or 2 months, and after 4 months or 6 months.
This is for boys also.
Yes, this can be given for boys as well.
Can be given or should be given.
Should be given, must be given.
Okay.
Must be given.
And we have another vaccine, the Sarvavac. The only good thing about this is the cost is a bit less. Licensed for girls and boys aged 9 to 14 years. Similar two-dose schedule, 6 months apart, and from 15, a three-dose schedule should be given at 0, 2, and 6 months.
So these two, both the vaccines needs to be given?
No. Sorry?
This is either or this is both? The vaccination? Either of two vaccine. Okay.
Either you can either give Gardasil or you can either take Sarvavac. These are the different types of vaccines which are available in today's market.
Okay, so any major difference in both of them, or they are same sorts?
They are actually they are manufactured by different companies. Sarvavac is a bit on the lesser side in terms of cost.
Okay.
But usually we use Gardasil 4 and Gardasil 9.
Okay.
But all are same. The thing is same only, but the cost and the manufacturer, they are different.
Okay.
Now this is nonavalent vaccine, that is Gardasil 9. It protects against the 9 high-risk HPV viruses, that is 6, 11, 16, 18, 31, 33, 45, 52, and 58. Gardasil 9 is licensed for girls and boys as well, aged 9 to 14 years as a two-dose schedule, 5 to 13 months apart. From age 15, a three-dose schedule should be followed at 0, 1 to 2, and 4 to 6 months, similar. But this is more effective because this covers all the 9 high-risk strains of HPV. These are the CDC guidelines. I think the minimum interval is 5 months between the first and second dose. The minimum should be 5 months. Actually, you should be given a 6 months interval, but minimum it's 5 months. If the second dose is administered after a shorter interval, the third dose should be administered a minimum of 5 months after the first dose and a minimum of 12 weeks after the second dose. So minimum interval is 5 months. Usually we ask the patient to take after 6 months. If the vaccination schedule is interrupted, vaccine doses do not need to be repeated. No maximum interval. We should not repeat. For example, if you have taken the first dose of vaccine and there is a interruption of the vaccination schedule after 2 months or 1 month, then you should not repeat the first dose. You have to take the second dose as soon as you get time. And 3-dose schedule. In a 3-dose series, the second dose should be given 1 to 2 months after the first dose, and the third dose should be given 6 months after the first dose. That is 0, 1 to 2, and 6 month schedule. The minimum intervals are 4 weeks between the first and second dose, and 12 weeks between the second and third doses, and 5 months between the first and third doses. Now, vaccination between the age of 27 and 45 years. Vaccination is not recommended for everyone older than 26 years. But in general, vaccination in this age range provides minimum benefit because most people have already been exposed to HPV or either they are sexually active. However, some adults aged 27 to 45 years who are not adequately vaccinated might be at risk for new HPV infection and might benefit from the vaccination. So, even if we are sexually active or even we have been exposed to HPV, it's recommended that you take the vaccine.
What about 45 plus?
The WHO says that the maximum range for the age is 45, but we prescribe this vaccine for patients who are more than 45 years of age as well.
Okay.
So you can give it to patients who are more than 45 years. We usually prescribe. They might be benefited from the vaccine. New HPV vaccine, if already had an old one, what should we do? The CDC doesn't currently recommend additional vaccinations with newer Gardasil 9 because the earlier versions, Cervarix and Gardasil, protect against the most high-risk strains of HPV. As I have told already that 16 and 18 strains, they are the most oncogenic and they are responsible for producing cancer in a human. So if you take Gardasil 9 or Cervarix, it will give similar benefits as well. Now, there is a single dose schedule as well, but this is under trial. So I don't think this is recommended in today's world. Now, vaccine immunogenicity, efficacy, and effectiveness. HPV vaccines are highly immunogenic. Natural infections delivers virus via the mucosal route with limited inflammation. The serological response to vaccination is much stronger than the response after natural infection. So even if we develop HPV infection, we are exposed to HPV, then we develop antibodies in our body. But that is not enough to protect you against the cancer cervix. So if you take vaccination, that the response will be much higher in response to serological response. In a meta-analysis, 3 doses of the bivalent and quadrivalent vaccines offered significant protection against cervical adenocarcinoma and situ. These are all studies. Studies have shown that this is more effective. That if you, it is more effective against HPV 16 and HPV 18 among young women aged 15 to 20 years, about 88%. According to a study, the risk of CS cervix among participants who had their first Gardasil vaccine in less than 17 years was 88% lower than among unvaccinated participants. Among HPV naive individuals, means the individuals who were not exposed to HPV infection, the quadrivalent vaccine gave 100% protection against anogenital warts associated with HPV 6 and HPV 11. So this is quite effective. The vaccination is quite effective. Now, vaccination of immunocompromised and HIV-infected individuals. HIV is another virus, and immunocompromised individuals means, for example, if anyone has any kind of autoimmune disease, or someone who has undergone organ donation, or someone who has received organs. So regardless of age or antiretroviral therapy status, should receive at least 2 HPV vaccine doses, minimum 6 months interval, and where possible 3 doses. So they should also be vaccinated. Now, duration of the protection, bivalent and quadrivalent, that is Cervarix and Gardasil 4. The duration of protection is more than 12 years. And nonavalent, that is Gardasil 9, antibody titer remains high for 6 years. And in a study comparing 1, 2, and 3 doses of quadrivalent vaccine in females, vaccine efficacy against HPV 16 and 18 infections was high for at least 10 years for all the schedules. And there is no evidence to suggest that a booster dose is needed after you complete the vaccination schedule. So there is no need of any kind of booster dose. So there might, as you have asked, that there might be some side effects after the vaccination. There might be mild systemic events, or there may be local adverse effects, but no serious safety issues except rare reports of anaphylaxis have been reported till date. Local adverse events such as injection site reactions, there might be pain or redness and swelling in the injection site, and mild systemic events, for example, headache, dizziness, myalgia, arthralgia, and gastrointestinal symptoms such as nausea, vomiting, and abdominal pain. But on long-term basis, there are no such side effects of this vaccine. And is this vaccine safe in pregnancy and breastfeeding? It is not recommended for use in case of pregnant women. If pregnancy occurs following the first dose of vaccination, the subsequent dose should be delayed until after the pregnancy. And that means it does not have any kind of toxic effects on the fetus. But if you have already taken the first dose, then you can skip the other 2 doses till your delivery. And termination of pregnancy is not indicated if vaccination was given inadvertently during pregnancy. That means there are no toxic effects to the fetus. And this vaccine is very safe during breastfeeding. You can take this vaccine while you are breastfeeding your baby. Co-administration with other vaccine may be administered concomitantly with other routine vaccines containing diphtheria, tetanus, acellular pertussis, and no interference with antibody response to any vaccine. That means if you can take other vaccines as well with this, there are no such drug interactions if you with other vaccines as well. Now, take-home message. According to the 2020 WHO Global Strategy, HPV vaccines should be included in all national immunization programs and should reach 90% of all girls by the age of 15 by 2030. HPV vaccination is a primary prevention and does not eliminate the need for screening later in life. Even if you have taken the HPV vaccine, it doesn't mean that you will not go for screening. You have to do the screening. By screening, I mean the pap smear test or the LBC test. That is, we take a cervical smear and after the age of 25 years, and then you have to repeat it in an interval of 5 to 10 years. So even if you have taken HPV vaccine, you should go for screening tests as well. The vaccines provide excellent protection from most HPV related infections, but none of the vaccines protect against all high risk HPV strains. Anyone with a cervix still needs routine screening to catch a cervical cancer in the early stages when it's curable. Thank you. If there are any questions.